My name is Dr. Mary Monibote, a urologist and the head of Department of Urology in the University of Ghana Medical Center. The month of September is prostate cancer awareness all over the world, and it's important to have this discussion about prostate cancer. Prostate cancer is one of the leading causes of cancer death amongst men worldwide. Early detection of prostate cancer has implications to survival rates in men. Men above 40 should have a discussion with their doctor about prostate cancer screening, which involves a simple blood test, which is a PSA, and a digital rectal exam, and this can make all the difference in their health.
My name is Reverend Theophilus Kofi. I serve as a resident pastor of Calvary Worship Center located at Ghana. As a very meticulous person, I usually do my annual medic checks, and on this occasion in 2023, my personal physician felt that there was something a bit different from my past records, so he recommended that I see the urologist. My PSA, as part of my medic checks every year, had gone up slightly. And so when I met a urologist, she decided that, look, I'll put you on some antibiotics for 2 weeks to see if it's just an infection or there's something else than what he was suspecting. So we went through that. After 2 weeks, I went for biopsy, and from the biopsy, we could tell that something was beginning to form within the prostate. And so the recommendation was that after other checks and scans, it looks like there was a problem within the gland. So I needed to go for surgery. As a servant of God, the first point of call was to pray about it. Then have a discussion with my wife that this is what is being suspected. I think the early detection was good because then there was no issues and no challenges thereof. And by reason of that, you were prepared for the surgery. Initially, it came as a slap in the face because one, I haven't gone through under the night before, and you haven't had of any experiences. But lo and behold, as God would have it, went through the procedure, going through anesthesia on the table for quite a lengthy period. And then when I came around in the ward, definitely your situation has changed a little bit. You had to now, UNRA was through another means. But there were aches, there were spasms, a bit of discomfort, but with encouragement and education I had received earlier from the urologist, it made everything conceivable. My personal physician, who felt, even though the disparity was not so great, he felt like, let's get into this and get to the bottom of it. To the urologist in question was very educative, calmed my nerves, explained what the issues were and why we needed to go by surgery. Then of course I have family, I have friends who were supportive, encouraging, prayer. I think that was also great. Basically, I think men are a bit tough, we are a bit conservative, we don't open up easily with issues, we try to play tough, and that is where the challenges are. I will encourage every man to rigorously do Medichecks annually, especially the PSA. Then for those who are going through a therapy or the process, it's a bit discomforting, but you look beyond the discomfort at the final day when healing comes, and then you get out of this situation. So it's a process, and we have to bite the bullet and go through it. By and large, you come out a better person than before, because your urinal becomes quite smooth. There are no expectation of any challenges beyond the process. Early detection, lifelong protection.
My name is Reverend Joseph Asante. I'm working with Assemblies of God Ghana, pastoring a branch church at Kwabenya called Amazing Grace Assemblies of God. I'm also 55 years by the grace of God. 2023 December, we normally do our normal medical examinations as part of our part of our criteria for us to be credentialed as Assemblies of God pastor. I've been doing it every year, and thankfully I met Dr. Moni And so we talked, and she listened, and she opted that I do PSA. And so when I did the PSA, it came out that it's 7.2, and that was alarming to her. So I did a biopsy, and awaiting the results. And somewhere in December I came, and she said, the result says that your prostate is cancerous, and so an immediate attention ought to be taken. I've heard about cancer, and I'm scared of it. And so I asked again, are you sure? He said, yes, I am. But I will give you time to go and think about it. To be honest, how I walked from here to Legon Junction without taking a taxi, I didn't know, because a lot of thoughts ran through my mind. I thought that with cancer, you may die. And so all put together, we agreed on the surgery. By the grace of God, in April 4th, I was discharged finally, and I kept coming for reviews, and now I'm okay. The cancer has not resurfaced because my prostate has been checked. That was last year, it was 0.2, and this year is 0.21 or so. And so I'm still within the best range. And so I'm grateful that the early detection, if I have not come here on that December 2024, I wouldn't be sitting here. And so I think that the early detection saved my life. If not that one, I wouldn't be sitting here, and I'm grateful. On that note, I will want to advise that please, when you clock age 40, make checking your prostate a regular practice. It doesn't take anything it doesn't cost so much. So what are you afraid of? And so I will encourage that we make it a regular practice, a regular routine, that at least twice in a year, check your PSA, because early detection will save your life. I also want to add that our attitude as male contributes a lot to the late detections of prostate issues. And then I also want to plead that as a nation, as a country, awareness creation should be hyping up, because it is on the low belt. And so most people are ignorant about it. Others also don't care. But I think that awareness creation will help the situation, and we'll be able to break through that. I will plead with anybody who has been diagnosed with any kind of problem with your prostate, be it cancer, elevation, etc. Please, don't panic. Even if it is cancerous, don't panic. I was a cancer patient, and look at me, I'm alive, I'm healthy, I'm working, I'm kicking, as if nothing has happened. And so don't be scared by any diagnosis report that is told you, because you can be helped out of the situation. It is not a death sentence when you are diagnosed with prostate cancer. It's not a death sentence. You can be helped. Early detection is lifelong protection. So get yourself checked. Thank you.
One would ask, whose job is it to create prostate cancer awareness? Prostate cancer awareness is everyone's job, because a healthy man ensures a stable home, workplace, community, and society at large. Don't wait. Spread the news. Tell someone about prostate cancer, because early detection saves lives. Thank you and have a lovely day.
I'm Dr. Bernard Morton, consultant urologist of the Urologist Unit of UGMC, and we have dedicated September as Prostate Awareness Week. September in particular is a prostate awareness week throughout the world because of the increasing prevalence of prostate cancer in men above 50 years and in some men around 40 years, especially those who have a strong family history of the disease, or they have been diagnosed of prostate cancer previously, or prostate disease. The awareness is becoming very important because in black men in particular, they have a 2 to 3 times risk of developing prostate cancer compared to other races. Also, the Ghanaian population is aging. Majority of the men are 70 years and above. This shows why we should take prostate health very, very important, so that men in their advancing years can live comfortably, disease-free, and without much prevalence or symptoms and signs. So we are using this month to educate patients about prostate health. Early detection saves a lot of lives. You are encouraged to come and join us to educate you, yourself, the public, and the Ghanaian population in general. Thank you.
I'm Dr. J.C. Lamte, a urologist here at the University of Ghana Medical Center, Legon, Accra. It's September, and guess what? It's the Prostate Cancer Awareness Month. As a urologist, I daily see the devastating effects of late stages of prostate cancer. The green picture I just painted can actually be averted. And that's the message for this month. One significant step can avoid all this, and that is to get screened, to get tested, to see your urologist this very month and be evaluated for prostate cancer. Let's always remember that early detection does indeed save lives and will prevent all the complications from advanced prostate cancer. In fact, we are extending the call not just to the guys, sons, daughters, wives, in fact, mothers and fathers. We all know that sometimes the guys can be a little nonchalant, get caught up in all the activities of life to the neglect sometimes of their health. This month, give them a gentle push, a nudge, a reminder, an encouragement for them to make that appointment and get evaluated. Remember the message, early detection does save lives.